The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM. And WCWP.org. I'm your host, Rebecca Miller, along with our co-host, Otto Lohse. Good morning, Otto.
Good morning, Rebecca.
We worked it all out with your computer, we hope, so far today.
We'll see if I start to flicker.
And also, of course, Christina Liu, the radio show producer, and also the director of Senior Citizen Affairs for the Department of Services for the Aging Project Independence, and Dan Cox, the radio show executive director, keeps things moving along. Christina gets us these wonderful guests every week, and we're now in our 12th year, and this happens every Friday. Today's guest is definitely no different. Dr. Penny Stern, who is the Chief Preventative and Lifestyle Medicine at Northwell Health Katz Institute for Women's Health. So thank you so much for joining us today, Dr. Stern. We really appreciate you giving us some of your time to talk about this really very interesting topic that has been around quite a while, but it's really good to talk about it and have our listeners hear. We're going to be talking about health and healing for life, an introduction to lifestyle medicine. So again, thank you so much for joining us.
Thank you for having me.
We're glad that you're here. So let's just get right into it. What exactly is lifestyle medicine?
Well, it has a pretty defined meaning. It's the therapeutic use of evidence-based lifestyle interventions to treat and prevent lifestyle-related diseases in a clinical setting. And our goal is to give people the knowledge and life skills to make the changes they need to make that will address the underlying causes of disease. And of course, our overarching goal is to prevent, for as long as possible, people developing the chronic diseases that plague us so broadly in this country.
Right. Very interesting. What is the history of lifestyle medicine?
Yeah, people think that lifestyle medicine is a new concept, but it's not. Hippocrates, the father of medicine, he said more than 2,000 years ago that if we give every individual the right amount of nourishment and exercise, not too little, not too much, we have found the safest way to health. He said our food should be our medicine and our medicine should be our food. Food and exercise, they work together to produce health. So he was certainly a man ahead of his time. Maybe we could call him the earliest preventive medicine and lifestyle medicine specialist. If we go into this century, Thomas Edison, he hypothesized, and you may have seen a poster that's been made of his words, that the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet and the cause and prevention of disease, which is pretty good definition of what we try to do in lifestyle medicine. And these ideas, they continued to percolate through the decades until the 1990s, when the first comprehensive lifestyle medicine textbook was published. And that's when lifestyle medicine really began to expand, in terms of scholarly articles, in terms of developing the professional organization, the American College of Lifestyle Medicine. I should point out for people who may not know anything about preventive medicine that many of the founders of the lifestyle medicine movement came from the field of preventive medicine. Preventive medicine is dedicated to health promotion, disease prevention, but on a population scale, meaning dealing with huge populations and not one-on-one medicine. The people who work for the CDC, the World Health Organization, health departments, the federal government, the military. So preventive medicine isn't practiced on an individual basis. And a lot of the people in preventive medicine wanted to do prevention but on a one-to-one scale. And that's largely where lifestyle medicine kind of grew out of. And so now there are thousands of people who belong to the American College of Lifestyle Medicine. Um, I don't really know the number, but there are a goodly number of physicians who are certified in lifestyle medicine. And what's different about the American College of Lifestyle Medicine is that they also give certification, not board certification like physicians, but a different kind of certification to nurses, to NPs, to PAs, to anybody who's an allied professional who wants to be part of lifestyle medicine. They also provide, it's a different exam, but they also provide certification. So it's a very broad-based movement. And ever since it's kind of grown and grown, people have been very happy with it. And I think that's responsible in large part for the growth.
One of the things that strikes me with a lot of things, and this one in particular, um, a lot of people know that they should, like the preventive part that you talked about, they know they should do that. And it strikes me that the biggest hurdle you would have in your world is to make it that people really believe it and they really want to do it. Like people are in denial a lot. I mean, it's clear that people know they shouldn't smoke, but they still smoke.
Yeah.
How do you get that message out there that, this is for real here, this stuff. This is not
People do know, you're right. People do know. If you ask somebody, how are you supposed to eat? They will tell you chapter and verse how they're supposed to eat, but they don't eat that way. But they know about certain things. I think in large part, people's lives are so busy and people try, the easy way out, which is just to go, let's say, the fast food route, and to be more sedentary. But people actually do know. When you sit and talk with people, you realize that they do know a lot. It's just a matter of actually putting it, into their lives. You know, you can't point a finger at people and tell them this is what you're doing wrong. That is not the way to convince people. It's much more helpful to go over, and I do this in my practice. I think most people in lifestyle medicine have very comprehensive kind of intake questionnaire, all kinds of questions that you never get asked in a normal medical encounter, and to really find out about people's lives and how they live and what makes sense and what they think they can do. There's no point to tell somebody, do this, and then you find out they didn't do it. Well, I couldn't do it because you never asked. So a key thing is to ask people, do you think you can do this? And I think what lifestyle medicine provides in many cases is the support that people need to actually put these things into action. And that's the difference.
Yeah, I mean, I think it's complicated because when you're trying to get people to think about something that they know, like you pointed out, they know it's right, and they know I'll talk to myself too here as far as that goes. I try to live a good lifestyle, but I got a few flaws here and there. I may hit a fast food once in a while, not as a way of life, but you know that it's not really the best place to eat food in general. But that's life. That's what makes the world go around.
Well, once in a while is usually not the problem. I've had people whose their once in a while is 3 times a day. I mean, it's a real problem. Nothing done once in a while, with the possible exception of things like smoking, which has absolutely no redeeming virtue as far as I'm concerned. If you're going to have a McDonald's or something once in a while, this is probably not going to be a problem. But the problem is that there are so many different pieces to life, and it's overwhelming to tell people everything they have to fix. So you have to start small, little steps. And people, it's not hard to convince people what's good and what's not good. It's just that people need the support to do it. That could be friends, that could be family, that could be the doctor. it could be organizations, it can be many different groups to provide that kind of support. It's very hard to make lifestyle changes, just wake up one day and say, I'm going to do everything right. I think it's very difficult, and I don't think we should expect it of people.
Yeah, I have this thing that I've talked about here, that if you take on a big project, and if you look at the big project, it's overwhelming and you don't do it. So I use this phrase: "There's only one way to eat an elephant, one bite at a time." What you just described I think fits that perfectly.
Yeah.
I'm finding too in my journey that a lot of places are like supermarkets and fast food are taking a little bit of responsibility for these lifestyle, changes that, to kind of integrate them into our lives. I mean, my supermarket that I've been going to for years, in the last couple of years, instead of making the fast food or the kind of food with all the preservatives quick to go, now they have a huge section on salads, on fruits, so that instead of running in and grabbing, something that's easy to fix because you're in a rush, you can grab a salad with grilled chicken, or you can get these containers that have fruit and yogurt. And my supermarket, and most of the supermarkets I go into, do have these things. And, some of the fast food places also have a little healthier. I know, Wendy's will have salads, and there are grilled chicken sandwiches that if you scrape off, some of the tons of other things on it. So I think that, in terms of what we do know what's best for us, we all know how to lose weight. We all know, like you were saying, Dr. Stern, what is the right choice between a, double dip fried chicken cutlet and maybe a grilled chicken over a salad, but to kind of, have a lot of these companies and markets offer it, because it is hard. I mean, how many times, I'm running late, I'm coming home from work, I'm starving, it's too late to get something out, there's a Wendy's on the way home. Driving up there and getting a grilled chicken salad with avocado, and, it is so good. So I do feel like there are options out there, but you have to open your eyes and accept they're not past the produce aisle, because there are good choices there now.
Well, I think, most in all things, not only in food, but most companies respond to what people want. And as people have become more knowledgeable and more desirous of food that's healthier, they responded to that. I mean, I remember a time when there were no salad bars in the supermarket. That would be like, what? That just didn't exist. I think they respond to what people are asking for. So we have a lot more power than we think we have. I think, unfortunately, junk food and processed food, it tastes good. And we are prisoners of our taste buds too. We like it, and they know how to make it taste even better. The more salt and the more sugar things have added to them, the better it tastes, I'm sorry to say. So it's a combination of factors. I mean, you have to know what you're eating. You have to read labels. You have to look and see. If people would actually read labels on some of the things they buy, they would never buy it, because it's all chemicals and it's all additives. And if it's something you can't pronounce, why would you want to take it in your body? Now, fruits and vegetables don't come with labels. They may say what country it comes from, but they don't have ingredients in them. So I think that most people understand that the fewer ingredients that are added to your foods, the better. So that's part of the
it strikes
lifestyle
me that
medicine's belief.
The earlier in your life that you start living like this, you get into my age bracket or people younger than me who are still older, you've already developed a lot of bad habits, and habits are hard to break, especially when they've been going on for 40 or 50 years.
It's never too late to change, though.
No, I agree with that. I mean,
I think that using, people saying things like, oh, what can I do? I've been doing this, for 30 years.
Right.
Well, tomorrow is the first day of the rest of your life. You don't have to keep doing it, which is how people do change, because they realize that I don't need to do this. I mean, part of the reason why lifestyle medicine has become so much of interest to people is that people are looking around them and are seeing that more people than not have chronic diseases. And, that's the heart disease, the diabetes, the chronic pain, the inflammatory intestinal disorders, obesity, degenerative arthritis, goes on and on. And something along the lines of 130 million people, now it's probably closer to 140 by now, but have a chronic disease. And people see this and people understand this. And I think, once people realize that the estimates are that more than half of causes of death are related in some way to our lifestyle patterns, it really is eye-opening for people. And you can't blame genetics. People telling you everybody in my family was fat, so I'm doomed to be fat. Totally not true. Genetics suggests a tendency for certain things, but people have not, given into that. Some things are inevitable. There are genetic diseases that you can't escape from, but most things are people saying things like, we're all heavy in our family. Well, that's because they learned those behaviors in their family. Everybody ate the same way. We didn't exercise, et cetera, et cetera. And so it's not genetic at all per se. It's just the way we learned. And, there are reasons how things have changed in the last century or so. We're not eating the same way we ate 100 years ago. And most people are aware of that. We've changed. We can get food from everywhere. We process food, we ship it, we store food, and people can do whatever they want when it comes to food. And by the same token, we developed methods of transportation that people are sedentary. People used to walk everywhere, and now they don't.
It's true, and we will definitely get into that because that was kind of where I wanted to venture into next, more physical activity and how that plays into lifestyle medicine. But we have to take a quick break. We will be right back with Project Independence and You Community Talk Radio, and we've been talking with Dr. Penny Stern, and you're listening to Project Independence and You. We'll be right back.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto Lohse and Christina Liu, also, of course, Dan Cox. We've been speaking with Dr. Penny Stern, who is the Chief of Preventative and Lifestyle Medicine at Northwell Healthcare's Institute for Women's Health, and really just getting great information. Before break, we just started talking a little bit about physical activity and, the importance of it. And I know one thing we were talking about, like you had said, just because something might be genetic disposition or there's a risk factor doesn't mean that you're 100% guaranteed to have it or to have to live that type of a lifestyle. I teach yoga. I'm excited to teach yoga to our seniors. And yesterday I taught a chair yoga class at the Roslyn Community Center for Northwell. Nurses are doing a bingo and a heart. We do take blood pressure. It's like a nice program. And I would say for the most part, the seniors that take the chair yoga are a little bit more frail, a little bit older. And part of what we do is we tell you're never too old to start. You're never too old to get stronger, You're never too old to learn a physical activity. Chair yoga doesn't mean that you're not coming into full practice. Your chair is just bringing the earth closer and in fact allows you to come into poses, as your body wants you to. Because we have to listen to our body, because if it hurts, you don't do it, especially as we get a little bit older. There's a difference between this hurts and, oh, this muscle hasn't worked in a while, I'm going to be sore. There's that big difference. So I'm loving lifestyle medicine. And what I want to say, what is the percentage that someone, especially as we get older, should include physical activity and daily, weekly?
Well, physical activity, I like to say that nobody is exempt. In other words, there are people who are chair bound because they're in either motorized or regular wheelchairs. There are people who really have limitations. They're not exempt either. If somebody is lucky enough to be able to walk, whether with an assisted device or freely walk, that's great, but everybody needs physical activity. We advise everybody to adhere to the American Heart Association's and everybody else's recommendation for 150 minutes of moderately intense physical activity over the course of a week. And if you break it down over 7 days, you see it's not really very much. The benefits of this, even small increases in exercise, can help in the management and the prevention of many chronic diseases. I like to view exercise as necessary medication. People are good about, or sometimes good about, taking their pills, but this is like a medication. And unless somebody has a job where they're a personal trainer or a physical therapist or a construction worker or something else that requires a lot of physical effort, most people don't get enough activity. And there are so many benefits that people who routinely exercise can accrue. For one thing, better sleep, which I can talk about later, but that is a key thing, that people who exercise sleep better. It's just a fact. The brain and the nervous system produce endorphins, which are like natural opioids, and that makes you feel good. It elevates mood. So people who are routine exercisers feel that elevation of mood. If you ever heard of runner's high, it's no joke. Exercise makes people feel great. Also, lower levels of stress, feeling more energized. People of high blood pressure find that if they exercise routinely and maintain their weight at a healthy level, they may require less medication to manage their blood pressure. The key thing that I tell people, especially people who are concerned about heart disease, is that exercise can reduce inflammation, and inflammation raises heart disease risk. And that's something people, should think about. And one thing which I don't think you have to be an older person to be concerned about this, but people who are routine exercisers are at reduced risk for developing dementia. And that's something that many people fear, but it's not surprising, because if you exercise, you increase blood flow to the brain, and increased blood flow to the brain keeps the brain healthy. So the fact that, and yoga fits in that category as well, all physical activity helps, which is why when people are exercising, their cheeks kind of get flushed, and that's blood going upstairs. And you don't have to do tens of minutes of exercise at a time. You can do 3 minutes, 5 minutes, 8 minutes, these bursts of exercise, whatever people can tolerate. It also can add up to the 30 minutes, more or less, a day that people, should be getting.
Yesterday, in line with what you were just talking about, a cousin and I decided we were going to go in to see the new Grand Central Madison station. All right. So that starts by me walking for 20 minutes to the Long Island Railroad train station. And then when you get into the train station, you got a lot of walking to do. And then I don't know if you've been there yet, but this is an unbelievable complex. And to me, it's like miraculous that they even could do this.
Only
This
took
is
him
what,
60 years, but okay.
yeah, it did. Yeah, you're right. It started verbally a long time ago, but it's 150 feet below Grand Central Station. That's 15 stories below Grand Central Station. And the whole place was just to me an engineering marvel, the whole thing from one end to the other. But that's not my point. The point is that we were doing this just to see. We were curious. But by the time the day was over, I looked at my Fitbit and we did 10,000 steps. You know, there's
Wow.
no real, it wasn't like we were trying to run around the track 20 times. This was just, then we said, okay, I'm not going to go home from there. We'll go to Penn Station. So we walked to Penn Station. And by the time it's all over, you've done a lot.
Yeah.
And you might have had a good time while you were doing it, which we did. Um,
Well,
so,
people often have to think about how they can get more physical activity, taking the steps instead of an elevator. If you're a driver, driving further away from where you have to go and then walking the last, few feet. Walking is great exercise if you can do it. And you don't need special equipment and you don't have to join a gym or a club. Um, but like I said, there are people who aren't able to do extensive walking. And then you have things like chair yoga, Tai Chi easy, swimming. There's many things people can do, but it requires a little planning. And I think that people sometimes get overwhelmed by, oh, this is too complicated. But just little things. Wearing a Fitbit type device, pedometer, is great. For some reason, a few years ago, they came up with the 10,000 steps idea, and it's actually not true. They studied how many steps do people need to get the maximum benefit in terms of mortality prevention. And they actually came up with 7,500. And that anything after that is nice, but it doesn't actually change anything. So people who are afraid I could never do 10,000 steps, most people just by living and moving around are getting several thousand steps, something like 2,700, I think. So
Right.
the more that you move around, the easier it is to get the steps. But it's a lot easier than people think. As you saw by taking a little, day trip, look at that. I mean, it's
Right.
not that hard to get movement. It's just a matter of planning a little bit
of
for it.
movement, really.
Yeah. One of the things I just wanted to add with the class yesterday is I talk a lot when I give a lot of instruction, but I also tell them why we're doing the things that we're doing. Why do we breathe in? We're expanding our lungs and all the kinds of things. And I also, when I told them, you're never too old to get stronger. It empowers them because they don't believe it. They come to yoga. It's like, really, I mean, at any age, like you were even saying, Dr. Stern, someone, who is, perhaps in a wheelchair, there are so many things you can do, even if it's just breathing to expand the lungs. But when you tell someone who believes, I can never do 10,000 steps, so why even bother walking? Well, you could do 4,000, it's, you tell them that, it's almost like you give them that little excuse not to do it. But when you explain you're never too old to do a little exercise. I mean, there are people who've never done any exercise. They really don't think they have. Maybe they've worked in the city and like walked to the train station or walked to their office and back to the train. I mean, they don't realize that they have actually exercised. But just adding a little bit of lifting and flexing and that, like you said, it doesn't have to be an hour a day. And it is empowering. People, they like to hear it. They're like, oh, wow, I can still improve myself, my strength as I get older. I mean, I think that when you explain it to them in a way that, you don't have to run a marathon. You could sit in a chair and, reach your arms out, take in the breath and it's helping you. So there's something to be said like for that. But I think it was Otto had a question too that kind of ties into this. How do you convince, but how do we get the word out about this type of medicine? I know, like, for instance, we have you on the radio show and, it'll be all over North Hempstead and seniors, but, it's so important. How do you feel most people come to you or to a practitioner who like specializes in lifestyle medicine?
Well, I think um, most people come to me by virtue of being referred by another Northwell person. Some people see something online. A lot of people are just very good at, you know, surfing and they find something.
Right.
There are, depending on where somebody is located, there are people who promote themselves as lifestyle medicine practitioners, um, and they may find somebody that way. I think, like we used to say in prevention, that everybody is a preventionist.
Mm.
Whatever specialty you're doing, you're a preventionist. Well, we say the same thing with lifestyle medicine. Everybody should be practicing lifestyle medicine. The problem is that most people don't have time. They have time to do whatever it is, what brings you here today. Here's your script, see you in
Right.
whatever. Um, that's the beauty of what I get to do. I get a lot of time with people, which is unusual. There are a few other people at Northwell who are certified in lifestyle medicine, but they're internal medicine people and they're doing internal medicine. They're trying to bring more lifestyle medicine in. And in fact, you may have heard of this in last December, the mayor of New York City, Mayor Adams, had a press conference where he announced, together with the president of the American College of Lifestyle Medicine, a new initiative that every New York City clinician, whether you're a nurse or a doctor or a PA or whatever, would have access to 5.5 hours of free medical training in lifestyle medicine that was being paid for by the American College of Lifestyle Medicine in conjunction with New York City. And it was announced and it is in existence at Northwell, and people are doing these 5.5 hours, and hopefully they'll be able to incorporate in whatever it is they're doing, the elements of lifestyle medicine. I had a plastic surgeon call me not long ago, very eminent, and he said he's really interested in lifestyle medicine. And I said, "What, are you joking? I mean, you're going to do lifestyle medicine?" And he said, "No, I'm going to send them to you, but I want to know about it." And it was really funny. I mean, I thought it was great that you don't think of plastic surgeons as thinking about lifestyle medicine, but he said, I don't want to operate on a person X because they can change something with lifestyle medicine and then they'll be in better shape for me to operate on them. I mean, it made a lot of sense, from his perspective. But, the key thing is that people have to be able to either talk to their physician about their problems. Sometimes there's not a whole lot of time, but that's why I always recommend people to go to the doctor with a list of things, because everybody remembers everything when they walk out the door. Oh, I should have asked him about the whatever, and they, too late. They walk out the door and they go, "I got a question, doc." Well, they don't really have time for this. But if you start off by saying, "I'm interested in diet or exercise or sleep or any of the pillars of lifestyle medicine," they will respond. If they happen to know somebody, as we do in Northwell, and they'll send, I get a lot of patients through someone who's a rehab doctor. And these are people who want to make changes. They've already been injured and they want changes. Some people who've had cancer and now they've been treated and managed and they're in remission and they want to make changes. And so they send them to me. And they don't have to keep coming to me. I mean, the point is that they only come when they want to come. It's not like you must come every week and I'll see you. It's totally different kind of, and they can call me whenever they want. They don't have to come, to have an appointment. They can send a text message or an email. And people do well. I mean, sometimes it's just a matter of people having, the time to talk about what's on their mind, because they do.
There's such a mind part to this whole thing, your determination and your desire and your self-motivation. And it's not an easy thing. I mean, it's the hardest part. We all wrestle with something. Like, I really don't like exercise, I'll be honest with you, but I've walked all my life.
That's good.
And I do force myself to do like 15 minutes with a couple of dumbbells and stretch bands, but I don't really like it. But I do it with a big picture of my family and a golf course in front of me when I do it, because that's why I'm doing it.
But
I
you
want to
golf
be,
and bowl, Otto. So
I
that
do,
is
yeah.
exercise.
Yeah, but that's exercise. I mean,
Yeah.
people who are used to moving around tend to move around. It's people who've been sedentary, sit in front of the television and eat chips or something. Um, those are the people for whom the benefits have to be explained, and that they can do it, and you don't have to sit in front of the television. Um, it's hard. It's hard.
Yeah.
Well,
You know what? We're going to take a quick break. Perfect timing. We'll be right back with Dr. Penny Stern, and we're talking about health and healing for life. A lot of information on lifestyle medicine. We'll be right back after a quick break.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto Lohse and Christina Liu and Dan Cox. And we're speaking today with Dr. Penny Stern, and we're learning a lot about lifestyle medicine. I'm super informative. And we're so glad to have you here, learning a lot, and there's nothing wrong with that at any age. Before we get on to sleep, because that is, I mean, for most people, either they can't fall asleep or they can fall asleep, but they can't stay asleep, or they wake up too early and they can't fall back asleep until it's an hour before they're supposed to get up. I mean, and I think as we get older, it seems it gets more complicated, sleep. But just a quick thought or question or, lifestyle medicine. And I think, Otto, I thought you were going there at one point. With younger people, schools, has the meals improved in schools? Is it just some schools? And is there like regulation to like throw in healthier foods? I mean, I can tell you when I was in elementary school and high school, there was never anything. There were really maybe there were like a basket of green apples that only turned green because they were so old. So, but because, it's hard to change to change your life or when we're older. So we're talking a lot about that. We have to convince people. They have to find the right kind of doctor. So is it better to start at a younger age? And are there lifestyle medicine changes that are in schools?
I can't speak for what the schools are doing. Usually school food has been, unless it's a private school where they go out of their way to, pay for excellent food. But I think they're trying to change what passes for school food. But I think most of what people learn, they learn at home. And if you're someone who starts every meal with a big salad and you give kids water and not juice to drink, juice is high calorie and it's not as useful as hydrating with water or seltzer, not club soda, which has salt in it, but seltzer. I think these habits start young and people are used to it. Kids who don't routinely eat candy. People who don't routinely snack, but have meals. And if they do snack, it's things like fruit or vegetables. I think nutrition, you can speak for hours on nutrition. Lifestyle medicine supports a predominantly plant-based diet, meaning avoiding animal-based foods as much as possible. But a lot of people are not going to give up their animal foods. So we try to tell people to avoid saturated fat. That's red meat, butter, full fat cheeses, full fat milk. You go with a fat-free route, and chicken and fish, that kind of thing. But plants are really good for us. Nice to tell people be a vegan. Not easy to be a vegan.
Right.
And even vegans have a hard time often balancing what they want to get. Not impossible, but we do like a plant predominant diet. And you can get, you don't have to take supplements unless you're short in vitamin D, which a lot of people are. But there are people who take dozens and dozens of supplements. You don't need supplements. You should get your vitamins and your minerals from your food. And if you looked and saw which foods, especially plant-based foods, have these minerals and vitamins in them, you realize you don't need to take. I mean, people want to take a daily multivitamin, why not? Especially if their diet is poor. But people should get used to getting their nutrition from food. So that's a huge topic in and of itself.
Right, right.
You mentioned before about sleep.
Yeah.
We emphasize the benefits of sleep and the consequences of sleep loss. Sleep problems are related to many factors. I like to blame, sorry, I have to do this to Thomas Edison, but the electric light bulb was not a great thing in terms of sleep because we are hardwired to sleep in the dark and awake with the dawn. That's millennia, hundreds of millennia of human development. And suddenly you had a device that would allow you to be up in the middle of the night, and people are. We don't go to sleep at the right time. We go to sleep much later than we should. And we have electronics, which is a whole other problem related to the light that comes out of electronic devices, which people are addicted to. In the last couple of, I guess, 150, 200 years, we moved from agricultural living to urban living. And in a farm, people went to sleep when it got dark and they got up in the light. That's how we were supposed to live. And suddenly in urban areas, everything changed. And it's a problem. We're not nocturnal animals. We're actually supposed to sleep in the dark. That's why people who work at night can have such troubles because they have to sleep in the daytime, and it's very hard to do that. And when your sleep-wake cycles get disturbed, it's very difficult. And we need sleep for so many things. People complain they're losing their memory. They think they're dementing. They're actually not sleeping right because consolidation of memory happens during the deep stages of sleep. And if you don't get those stages, you don't remember. And that's why sleep-deprived people are forgetful. So all the people who crammed for exams all night long and wondered why they didn't do well on the exam the next day because there was no time to consolidate memory. There are lots of problems with insufficient sleep, especially in this day and age when people are so worried about pandemics and other illnesses. Your immune system gets suppressed when you don't sleep enough. Your likelihood of developing diabetes, obesity, heart disease is all elevated when you don't sleep enough. Car accidents, even slips and falls, just regular, plain old everyday accidents. So people really do need 7 to 8 hours of sleep. And a lot of people are proud that they sleep 4 or 5 hours and they're fine. Well, they're fooling themselves because they're not fine. We really do need sleep. And of course, the $64,000 question is always, well, when should I go to sleep? And believe it or not, you're supposed to go to sleep within an hour of when you first start to be tired. And that's a lot earlier than most people are willing to go to sleep. I have to watch the news and I have to watch the movie and I have to do this.
I have about an hour then before I need to go to sleep.
before you nap while you're watching something.
Well, napping is a different problem. The problem with napping, and this is something that a lot of older folks fall into this trap. They don't sleep well at night.
Right.
So if you don't sleep well at night, you're sleepy in the daytime. I mean, you got to sleep sometime. So they nap. And the longer you nap, the more your sleep-wake cycles get disturbed. So napping is a double-edged sword. I mean, if you want to take a nap, it should be early in the day and no more than 20 minutes. And if you ever watch somebody who's sleeping every couple of hours, you know that people are not sleeping for 20 minutes. So napping is a problem. And the way to know that you've had enough sleep is when you wake up in the morning without an alarm clock, but you wake up in the morning and you feel like you can climb Mount Everest. Then you had enough sleep. If you wake up and you go, I got to put my head under the blankets because I can't, you didn't get enough sleep. You just didn't. That's what sleep is. It's restorative. And if you don't get enough sleep, you're starting every day at a deficit. And that's what's so problematic about not getting enough sleep. And believe me, something like 3/4 of the adult population in this country doesn't get enough sleep. So we tell people they have to maintain regularity of sleep and wake times. If 9:30 at night is time for you to go to sleep, you go to sleep at 9:30. If you get up at 5:30 in the morning, that's not bad. If you sleep from 9 to 5, so to speak, that's not bad at all. But if you're going to sleep at 11 or 12 and getting up at 5 a.m., that's not good. That's not going to work. And eventually, people don't need clocks. They will get up every day at the same time if they keep this regularity of sleep and wake. It's important to get natural light, not electric light, but to go out and get natural light. That helps, the brain also, cycle properly. Exercise, I said this before, and I'll say it again, exercise outdoors is even better than indoors, but exercise reduces the amount of time it takes to go to sleep and it increases the amount of time you sleep. And it doesn't take much exercise. Believe it or not, there was a study, I think it was the University of Arizona, that said if you walk 6 blocks at a normal pace during the day, 6 blocks is not too long for people who can walk, you'll sleep better at night. It helps, exercise helps get the biological clock into a consistent pattern. And does a lot of other things. But, don't exercise late at night. Anybody has ideas that I'll exercise and I'll go to sleep. Exercise energizes you. So if you energize yourself, you're going to energize yourself right into insomnia. So no exercise in the couple of hours before sleep. Do your exercise in the daytime. Bedroom should be cool. Most people like to sleep in warm rooms, but that's why God created pajamas and blankets. The room should be cool. Your head should be, the ambient air around your head should be cool. You think of where a bear hibernates. A bear hibernates in a cold, dark cave. They don't hibernate on the beach. So warmth is not helpful for sleeping. Coolness promotes sleep. People who are cold fall asleep. As long as it's around your head, the rest of you can be warm. And of course, darkness. And then that people bring up the question, well, I have to get up and go to the bathroom at night. That's why we have night lights, little night lights to light your way. But don't turn on an overhead light because the light is just going to wake you up. That's it. So night lights are very helpful. Quiet is nice. If you happen to live on a busy street and you can't make it quiet, get a white noise machine or something that makes that kind of hum that will make you sleep. There was a thing, and I do tell people to do this because it works, even though the scientific reasoning is a little unclear about wearing socks at night, because somehow keeping your feet warm, the reaction of the body seems to be that your core is reacting to the warmth, so it cools down, and people sleep better with socks on. But they have to be like, natural fiber socks and not socks that are binding. People wear these socks that make, lines in their legs, not that kind of thing. So socks is a good thing. And of course, watch the napping because napping is a problem.
Definitely. Well, that was a lot of great information. I feel like so much of it we know, but, of course, our own lifestyles, like someone like me who comes home from work, has an hour drive home, then has a meal and then goes to the gym, and it's kind of, it's rough, but, but you gotta, I don't do it every night. So,
go to the gym at 5:30 in the morning.
Yeah, no. I mean, I am a big believer in, being able to adapt, but that is one thing I've never been able to. I've tried. I've gone to the gym really super early, but I don't know. My body is just not liking it. But I maybe I'll give it a try because you really do have good information.
Well, it has been studied. I mean, there are people studying all of these elements, and we know things. Sometimes it's impossible. There are people, as I said, who work strange hours or who have rotating shifts, and they really suffer. They're more prone to having various problems because of those, but somebody has to do it. So, the best they can do is to make sure that when they do go home, they go to sleep. What happens with most night workers is that they go home and then they go to the bank and they go to the post office and they go to the supermarket. And if they see their kids off to school, and by the time they get to sleep, they have to go back to work in a few hours. So they never quite get, what they need. So it's
Right.
it's a
Another
problem.
area that a lot of people wrestle with is the management of pain for a
Mm,
variety of reasons. What's the
yeah.
take on lifestyle medicine in terms of that?
Well, it depends what the source of the pain is. There are many pain causing problems. Um, but, people who are routine exercisers, for example, who have less problems with weight, often have less problems with certain kinds of pain relating to osteoarthritis. Or people who get involved with exercise often find that their pain is improved. Um, but sometimes pain requires pain management, and there are people who specialize in it. But I think there's so many different kinds of pain uh, that whatever the basic problem is, there's somebody who can deal with it. I do think that people who eat well, sleep well, exercise well, have less stress, they do well in terms of pain. Um, it's all related. And, after a while it begins to sound very redundant because you keep telling people the same things. You got to sleep, you got to eat right, you got, on and on. But it all works together. And that's what I think is people think of the things, these isolated problems, but it
Right.
all fits together.
I feel like there are so many people that I don't want, I mean, maybe their cholesterol is high and the doctor gives them a medicine and it comes down. It doesn't mean that you can continue eating bacon. It's not just the medicine. You have to,
Yeah,
it's the lifestyle
that's the
change.
old problem.
Right.
People with high blood pressure take the the medicine they're given, and then they think they can do whatever they want because they're
Right.
taking the medicine. That's not the point. But nobody ever takes the time to explain this. Same thing with
Right.
diabetics. Something like 11 out of 12 diabetics don't follow the ADA recommendations for diet. But they think I'm taking my whatever. I don't,
Right.
I don't have to think about it. That's not how it works. But nobody ever tells people that. So it's a problem.
Right. Right. Well, so I mean, I think lifestyle medicine clearly needs to come into, the realm of family practice and, just kind of information. It's so important. And like you said, it's not something that you have to do every week. It's just get the information you need and try to adapt to that lifestyle. And, these are all choices too. You're making a conscious choice, I think, in a lot of instances, not to pick the right thing for you. So there, part of it is really a responsibility on each person.
Yeah, well,
If you,
I got to tell you though, I hesitate to use the word choices because choices implies that people are making decisions based on having knowledge, but a lot of the decisions are made by people who don't know. And so it's not really a choice.
right,
So I can't
right,
really
okay,
blame people for doing things that they don't. Once they know, if they know the right thing and they actively choose not to, that's a choice. But most
right,
people, it's not choices. It's really just not knowing. And again, as I said in the beginning, many times doctors tell people to do things, but they never ask them if they think they can do it. They just assume it. And when they come back and they find out they want, why didn't you do it? It's like people not taking medicine as prescribed. Well, did anybody ask them whether they thought they could take medicine 3 times a day or something? I mean, they don't ask them. And I think one of the key things we do is and I think a lot of people in medicine have taken this on is to say, do you think this will work for you? Do you think you can do this? Because there's no use in telling somebody to do it and they're going to go home and they're not going to do it because they wanted me to walk whatever, and my neighborhood isn't safe. I'm not going to walk alone, or the pavements aren't straight, or there is no pavement. I mean, like, you got to
right,
find out whether people, it's finding out about their community. It's finding out about what options are open to them. Do they have friends? Do they have family? Do they have people who can help and support them? I mean, it's much bigger than just a patient. It's their environment. It's their community. I always tell people, that's why volunteering is so helpful for people because they automatically have a community that they can deal with. I think Northwell, our oldest volunteer, was like 103 or something. And they asked him, why are you doing this? He said, what else am I supposed to do? I mean,
right.
it's a really good thing to have,
Well, I'm a
support in your
volunteer,
life. Oh,
and
well, there you
and
go.
what you said is true. Because of it, I have Christina, Rebecca, Dan, other people who are part of my life. It adds to your life, really, no question about it.
And you have added to our lives, Otto.
Well,
for sure.
Hopefully it's always a two-way street. But one thought, though, managing health is not just the doctor's job. It's our job individually to work with the doctors on, and there's a technical issue, to work with the doctors on the health management. It's not a one-way deal. It's not
it's
the
partnership.
It's
right.
Partnership.
Right.
And on that note, which is a great note to take a break, partnership, we do have to take a break. We want to thank you so much, Dr. Stern, for giving us an hour of your time. Just information was wonderful. I'm sure we'll have you back. I can't wait to have you back. You're listening to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. We'll be